Hi, everyone. I'm Kim Schonert-Reichl, a professor in the Faculty of Education at the University of British Columbia and also the director of the Human Early Learning Partnership, also known as HELP. And today I'm inviting you in for a Coffee Talks with Us, a series in which we're talking to a number of experts about important aspects of child well-being and mental health. Before I begin and talk about our speaker and introduce you to this, I'd like to acknowledge the traditional unceded territory of the Musqueam, Tsleil-Waututh, and Squamish people of where I am sitting today. Now, without further ado, I'd like to tell you a bit about our speaker. We're very fortunate today to have a world-renowned neuroscientist with us from the University of British Columbia, Dr. Lara Boyd. So she is a neuroscientist and physical therapist at the University of British Columbia. She's a professor and Wall Scholar. Dr. Boyd has held a Canada Research Chair, a Michael Smith Foundation for Health Career Scientist Award, and has been a Peter Wall Early Career Scholar. Dr. Boyd directs the Brain Behaviour Lab at the University of British Columbia. Her work is centered on answering the question of what limits and what facilitates neuroplasticity. Dr. Boyd also serves as a health research advisor to the Vice President for Research at UBC and the University Delegate at the Canadian Institutes of Health Research. Also, this is quite interesting. I love it that her TEDx talk has been viewed over 27 million times. So without further ado, let me welcome Lara. Wonderful to have you here with us today.
Thanks for inviting me, Kim. It's fun. I only wish we could be in the same room.
I know, and I do have my coffee, so I'm all ready for this help coffee talk. So, and I think, yes, I wish we were together, but it's really so exciting to be here with you today. You've done such remarkable work, and really helping us understand the brain and really recent work on neuroscience in really practical ways and strategies. So today, I'm inviting you to answer some questions. We're going to have 3 questions for you. And of course, we'll take longer. You won't have to have simple answers. Hopefully, you have long answers. And really thinking about some of the things that are really surfacing for us today, right now during the pandemic, during COVID-19. So, one of the first questions I have for you is, what is happening to our brains right now?
Yeah, this is something I've been thinking a lot about it, and we don't actually know for sure, but we I get to speculate. I think so. Normally our brains are very rich and very interested in learning new information. It's something we're doing all the time, and that's you use that word neuroplasticity when you're introducing me. So I just want to unpack that for a second, so everyone knows what that is. And the term neuroplasticity we use in science to refer to the brain changing. And what it really is it's the means by which we learn things. So every time you learn something new, you change your brain, you invoke plasticity in your brain. And our brains are amazingly dynamic. They're changing all the time. Doesn't matter how old we are, although children's brains are better at this than adult brains. It's a little bit sad for those of us who are adults, not for children. But so our brains are changing all the time. They're changing with every experience we have, all the things we learn, all the things we forget, all the experiences we have. And that's really exciting. And that's really been the focus of my research is how do we shape that change to benefit behavior. So because we're so changeable in our brains, part of what's happening in a pandemic, in a time of great uncertainty and in stress because things have changed, because things are uncertain. We have changing societies, changing in how people are doing their jobs, changing if people have jobs, big changes in how education is being delivered. That's causing stress. And one of the things that we understand about brain change is that stress very negatively affects the ability of neuroplasticity to take place in our brain. So there are some factors, we call them trophic factors. It's just a fancy word for growth. They're growth factors in the brain, and they enable our brain cells, our neurons, to be more neuroplastic, to change more easily. And one of these really important growth factors is called brain-derived neurotrophic factor. We call it BDNF. So this BDNF that's so important for learning, it turns out that the receptor that it binds to, it is competing for that receptor with our stress hormone cortisol. So what happens when we're in these periods of prolonged stress is that we actually have impaired learning because you have too much cortisol in your brain, and that then limits the ability of these trophic factors, these growth factors, to do their job, to allow brain plasticity and brain learning. So one of the things I've been thinking a lot about is what happens when a society, for example, is in this prolonged period of stress and uncertainty, and how might that be influencing the ability of our kids to learn, of us to all take advantage of healthy behaviors and encoding of new information, and it's going to be an important question that we're going to have to be asking and thinking about for some time going forward in our research. But we all know that feeling. I'll point out we've all had those moments in our lives where that feeling where you're so stressed you simply can't think. And this overwhelming flood of these stress hormones into our brain that are really limiting our ability to take advantage of information around us. And so that's probably a situation that we're in right now. Hopefully, as we're developing strategies, we're becoming more accustomed to kind of a shift in how we're doing things, as we're able to kind of predict a little bit better what the future might look like and plan ahead a bit, these cortisol levels are going to be diminishing, and we'll be getting back to a more normal pattern in our brain. But we're all reacting very differently to this situation, and it is something to be mindful of.
Yeah, and thank you so much. That's so important. And so essentially what you're saying is right now, because of these increase in stress hormones, it'll be really hard to learn new things. So this idea of going back to school, focusing on the academics right away might be premature because there's all this stress that's interfering with your ability to retain information. Can you tell me a little, I'm just thinking of some of the viewers we have probably have various levels of backgrounds, a little bit more about cortisol, because I think that stress hormone, is it always bad to have cortisol?
Yeah, so cortisol is a fascinating hormone, and it gets a bum rap. Like we always think stress, cortisol, bad, but that's actually not true. So everyone who woke up this morning, and that's everyone, turn to the left and say thank you, cortisol, because that's what helped you wake up this morning. So cortisol is a hormone that's secreted, and it rises early in the morning, and it allows us to wake up. It wakes us up. It says, oh, we're roused, let's be awake. And then typically it slowly diminishes through the day. It gets to a level that's quite low in the evening at night, and we fall back asleep, and then we repeat. And so cortisol actually is an incredibly helpful type of thing. If you have very low cortisol, you have very low arousal, you're very sleepy, very low levels of awareness and of kind of intention. And so that's quite bad. And then it turns out that very high levels of cortisol are also bad. So it can limit thinking, it can limit learning. It does other things too. It raises our blood pressure. It can cause you to have actually shifts in your cholesterol. So you can have higher levels of bad cholesterol when your cortisol is high. It impairs immunity. It can decrease bone density. So it has these really strange effects. So we think about cortisol, we talk about it as being an inverted U. So you want to have just the right amount, not too low and not too high. And then your cortisol swishes around with your behavior and your environment. So it's actually a very, very helpful hormone. There's a good reason we have it. Where we get into trouble is when it's persistently high, where you're pushing off that kind of that. If you talk about the inverted U, you have that peak where you want it. If you're pushing too far over towards keeping it high and keeping it high for long periods of time, that's where we run into trouble. And so that's what we want to think about. Can we mitigate that with other behaviors, or putting ourselves in different kinds of situations to kind of try to reduce and control our cortisol levels, so we have this normal pattern where it spikes up, helps us wake up, become aroused. Maybe we need little spikes of it, at different points in our life. We're going to take that important test. A little bit of cortisol kind of increases your attentional capacity. That's great. That's fine. But we want it to be able to go back down to low levels when we need it to.
Great. I'm going to do that now from on when I get up in the morning. I'm going to turn and say thank you, cortisol. I love that. That was great. So, in thinking about the brain and thinking about what's happening right now, one of the things that I know I'm experiencing, and I think others might as well, is the uncertainty. Like, I don't know when I can travel again. I don't know when I can come over to your house and have real coffee with you, Lara. I don't know when I'll be able to really, go to see my mom in Chicago. I just read this morning that, people are talking about a second wave coming now in the fall and into the winter. So what happens to our brain? Like, what's happening in my brain now with all of this uncertainty?
And this is really where the anxiety is coming in for all of us, which is represented in these stress hormones, for example. And I share all of those issues with you. For me, I know I'm just like you. I have my calendar planned 2 years in advance. Like, I can tell you the trips I've missed, the trips I'm going to miss, right? And the classes. And so it's really disconcerting to be unanchored, if you will, in terms of where I'm going, what I'm doing, who I'm going to do it with, when will we see our families, and really, ultimately, are we safe? Is really the scariest part right now. And that's what's really jacking up these levels of cortisol and stress, and so with good reason, because it's this idea, what one of the things that these stress hormones do is they're meant to keep us alive. They're meant to keep us on the edge so that we're vigilant for harmful situations. Think of them evolutionarily as reminding us that the tiger's out there at night and would love to have you as a snack, kind of thing. That's what they're there for. It's just I don't believe that there have been periods in time where we've understood the brain where we do now. We've had these prolonged periods of stress where, as a whole society, it's not just certain segments or groups. Everyone is experiencing this level of stress, and that's where you start to wonder a little bit about learning, planning, decision making. Certainly our leaders are under tremendous levels of stress and anxiety as well, and they're trying to make big decisions about budgets and healthcare resources. And so that's where it does become concerning. And I think as a group, we need to start and be very proactive about thinking about, well, how do we maintain our brain health through this situation so that we don't just become so awash with anxiety and stress that we're really paralyzed. And so we can start to return to some semblance of being able to learn, learning what we can plan and what we can't. There are some things we may be able to plan and look forward to. And then trying to kind of slowly take back, those levels of control so that we feel a level of comfort, which I think is also related to having gotten, these stress and anxiety and cortisol levels to a manageable level.
Yeah, and so I'm already beginning to think of situations where, maybe in fact, even just in among other people when you're out and about and how people react sometimes and to see, I've heard of people talking about places where they'll go to someone and someone will snap back at them because they're feeling unsafe. And I guess from what I'm hearing from you, that in some ways that uncertainty can affect our behavior. So the people who are under stress aren't having their brain work to its optimal and most rational. So have you seen any of those experiences where you have seen things unfold because of the stressed brain?
Oh, absolutely. They're all around us right now, aren't they? I saw something in the grocery store the other day. It was very simple, and someone was in someone's way and didn't realize, and this gentleman just went nuts. I mean, I actually was with one of my daughters and I was like, and we're going to back away now because this is a crazy situation and we're not going to, I was a little bit fearful for us. But it really, if you think about it, the person who was overreacting was scared, was frightened and felt unsafe in that situation. And so we think we're seeing a lot of that. I think what's important too is to have that knowledge right now to realize that that person's frightened and overreacting, probably reacting in a way they never would under normal circumstances. And let's give everyone the benefit of the doubt, a little bit of space, a little bit of a benefit of doubt that we're all feeling uncertain and scared, and come together as a community. And I have been really impressed, and I bet you have as well, by looking at the community and realizing, that people are really trying to help one another out. And that's quite lovely. And that does actually decrease my level of stress for some degree. So I have teenagers, young teenagers, and they're not sick. They don't know anyone who's sick. Their friends feel fine. But they've been very good about recognizing that we're doing this for, and we've actually named names, like who are the people that we're doing this for? Who are we worried about in our community? Is it your choir director, your teacher, maybe the older woman who lives across the street, maybe the cancer survivor who's a friend, and so I think that in calling out that this is for the greater good, that does give us some measure of control. And boy, I'd love to know if that's decreasing our cortisol, but I bet it is. But I
That would
haven't
be
done
such an interesting study, wouldn't it? To
oh,
actually see how that
right?
approach, and it really makes what you've been saying, and we'll kind of move into thinking about how to move forward. But as part of it, I think of, we have Dr. Bonnie Henry, our public health officer, who has used the phrase, be kind, be calm, be safe. And that idea, just what you were saying, is this compassionate interpretation of people's behavior. And I read an article where she actually says that her approach was inspired by Camus, the
Oh, really?
philosopher, from a book, The Plague, and that it really showed how people respond, in a bad way when they're under that stress. And so that's kind of her catchphrase. And I keep on, now as you're talking about it, I realize that she is trying to be the collective cortisol reducer of our community by using
Yeah.
really words that to me are speaking to people's brains, in some ways. So anyway, it's
Isn't it
very fascinating.
wonderful? Okay, now I'm gonna have to reread The Plague. It's been a long time. I think in college. But too, my first degree is in English literature, so I'm gonna have to go back and brush up because I should take a look at that. She is really, though, you're quite right. She is kind of our collective conscience right now for this. I was actually thinking of you. I have a question for you, Kim. So do random acts of kindness reduce people's cortisol? Has that work gone to that next level? Because that's really what we're doing, right? These are relatively random acts of kindness. We don't really know a lot of the people that we're protecting here. I don't know anyone in these retirement homes, for example, who are the people who are very vulnerable, who we're trying to collectively take care of.
That's a really good question, and I feel like this is great because we're having coffee talk. So even though I was going to ask you the next question, I'll just tell you a little bit about the research. We have not collected cortisol on our random acts of kindness curriculum. However, we have collected it for the Mind Up program, which is a program that embeds mindfulness plus social and emotional learning strategies, such as doing acts of kindness, practicing gratitude for others, and have found reductions in cortisol. Or really, what we found was that students who got the program actually maintained a very healthy pattern throughout the school year. These are fourth and fifth graders, whereas the kids in the control group who didn't actually had a very unhealthy, heightened cortisol, flattened rhythm, which just says what's happening in the regular classroom, because I think kids get stressed out. But I will say about one study, not that we looked at cortisol per se, but a volunteering study with high school students who were randomly assigned to volunteer with younger children after school in elementary school, and this was 10th graders, so 15-year-olds. They did it for 10 weeks, an hour and a half a week, collaborated with a health psychologist, Edith Chan, Hannah Schreier, and found that those acts of kindness, that volunteering, significantly reduced a risk for heart disease. It reduced both cholesterol as well as IL-6. So I imagine that cortisol was in the mix there, but there is something about turning your attention outward to others, to helping others, that I think reduces our self-focus and those kinds of things. But anyway, so I want to get to this because I want to make sure that we have enough time to really give people some practical strategies of really to think about what are some of the ways that we can mitigate these, we kind of spent the first part talking about all the things that are happening to our brains and the stress. What can we do to mitigate these issues? What's the advice you have for parents, for educators, and even for kids?
Right. Yeah, I know that's really the most important piece, isn't it? So I think the first is just knowledge. Knowledge is power. I'm such a firm believer of that. So just be aware that this is what's happening. This is why we're all feeling, wound a bit tight, or maybe you're having trouble sleeping, or maybe your kids are, really anxious right now. And there's a good biological rationale for that. We're in an unprecedented situation. God, whoever thought? I mean, it's just I don't even have the words for it, which is unusual for me. And so let's just be mindful of that when you're watching someone lose it in the grocery store. Give them a pass because there's a reason. We do have some awareness of behaviors, of activities we can engage in that help mitigate cortisol and stress. um, the one that I know the most about because we studied it in my lab and I use it in my daily life is exercise. So exercise has a very interesting effect on patterns of cortisol and on stress, and on learning. So, in terms of cortisol, when you exercise, what you actually do is you spike your cortisol, it goes up. But what we see then is it rebounds to a lower level and it stays down. So if you enjoy exercise, and by the way, it doesn't matter what form you take. I like to run, maybe you like to ride your bike. It could even be gardening, things such as this, taking a walk, that these are all behaviors that appear to be very healthy in reducing your cortisol. Interestingly to me, exercise is also well documented to promote the release of brain derived neurotrophic factor. So not only do you push down cortisol, but you elevate BDNF. And so one of the big foci in my lab has been, because I'm interested in how do you facilitate brain plasticity, is can we use exercise to make ourselves better learners? And it turns out our data show very robustly in young people, and we're studying this. Well, we were studying this also in older people and people with stroke until we were shut down a few months ago. We'll get back to it though. But we have shown that it is a very helpful thing for promoting learning. And so that's the first one. And so that's just kind of an easy one to start with because exercise is good for all kinds of other things as well, heart health and other things like this. So that's one quite thing. There's no magic prescription for how much or how long. Those are kind of questions we still have outstanding. But I would encourage you to find something you enjoy doing from an exercise standpoint and do it. The second one that you mentioned, which I will not even do other than to give you big props, is mindfulness has been shown to be very helpful in reducing cortisol, and that could be extended. And it's unclear how this all interacts, but we also have a study or two now showing that the practice of yoga also does something very similar. And it may be because mindfulness is embedded within the yoga experience. You're also moving, so you have exercise, so maybe you're layering these things together. But again, that has been also shown to be quite helpful. Sleep. Believe it or not, if you sleep, people who sleep 6 hours a night versus 8 hours a night, if you just add those extra 8 hours of sleep a night, you reduce your cortisol by 50%. Is that a remarkable thing?
Can I just say I'm I'm feeling so guilty right now. Sorry, cortisol. I'm going to talk to. Yes.
I know, and it's really hard. I'm normally a very good sleeper. I'm so exhausted by the end of the day. I just lay down and I'm gone. But I've been really struggling with sleeping, partly because there's no reason to go to bed because I don't really have to get up at any particular time, and this is easier said than done. But sleep is a really big deal, and so personally, again, and everyone needs to find their own recipe. If I exercise hard enough, then I can sleep. So I have this kind of exercise sleep relationship I've kind of found for myself over the years, and but it's one that is really important for reducing cortisol. It also can be really, really helpful. And then the other behavior that's out there that has been very well studied is meditation. And meditation is hard and quite a skill. But you see that people who engage in meditation, and these aren't, obviously the Buddhist monks are the very, very best, but they've spent their whole life practicing. But even people who take up meditation just after about 6 weeks of doing that 3 times a week, so very low and very early into the practice, you see very significant reductions in cortisol. So there's lots of different ways to do this, and I don't think there's any silver bullet. I think each of us needs to kind of find the path that feels better, or maybe some combination of all of them together. But these seem to be the things that are really very, very helpful in reducing those stress levels and then allowing us to maybe interact more healthfully with an uncertain world.
Yeah, and it makes me think that sleep. I'm just thinking about sleep right now because it's not. I'm wide awake. My cortisol's all good, but sleep in particular, because what I've heard of, at least reading, and I think I've experienced a bit myself, is just more difficulty sleeping. Like it just seems like having been on self-isolation, not doing my regular routine, getting out, driving to UBC, going back, coming home, going to the grocery store, doing the shopping so much. I just find that sleep has been altered, and I've heard of other people also having more difficult sleep during this time?
I think it's true. Everyone in my house right now is having trouble sleeping, or we're just sleeping weirdly. My partner's going to bed really early, but waking up at like 4. I'm like, if I made it past 10 o'clock, pre-pandemic, I was burning the midnight oil, but I'm like up till midnight, 12:30, and we are all over the place. Both my kids slept half the night on the couch last night. It's really a challenge right now. So actually, this is one of our big goals. We were just talking. I was talking with one of my daughters, like, okay, tonight we're making a plan. Let's all have a book and try to at least be pretending to go to bed by 11:30. They're also teenagers, so they're into that crazy teen sleep pattern. But it is really challenging. And I'm hearing too, and I'm not sure if I'm having these or not, but people talking about these COVID dreams, or they're just having these crazy dreams. And we've been talking a little bit about that here as well. So I don't know what's going on. Sleep is definitely, for me, it's being untethered from a schedule. Like I do have a schedule, but it's not, running at 5, breakfast at 7:30, meetings at UBC by 9, right? I'm not on this hardcore thing. So I'm all over the place. I'm quite messed up right now.
No, yeah, no, I totally agree. And I think I was gonna just sneak in one more question. And one thing is really think about what you're doing with your family, now to bring it like well, everything about the brain. You're this, expert in neuroplasticity and brain and
Uh,
stuff. And like how knowing what how do you bring that to your home? And sounds like I love your idea of saying like, okay, let's find a really, a sleep hygiene. I think of sleep hygiene and think about let's like maybe the way to slow down is to read a book before we go to bed. And do you have any other pieces of advice for that?
yeah, I mean, just a couple things I've been thinking about. The first one is we've just been trying to be kind and gentle. Our house is small. We're all cooped up, and just trying to take a breath before we lose our patience. At least for me, I think that's been a big thing. My kids have not enjoyed this as much as I have, but we've been trying to like actively practice gratitude at the dinner table at night. The one great thing is we have dinner together every night, right? Because no one's going anywhere. So that's been nice to spend more time and just really be grateful for that time together has been a nice side effect of this. And then, of course, everyone in here is very interested in exercise and trying to schedule that in whatever way. We all do something a little different, but really being actively focused on that. And we're working on sleep, but boy, yeah, I keep trying to practice mindfulness, and I'm just really terrible at it too. I have to confess, but that's a goal of mine. I have time, so um,
Well, I actually believe running is a mindfulness activity. Like, I think you can make it being really present. So, if you really think about practicing mindfulness of being present and really, not being judgmental, but really, experiencing, to me, I love, doing a mindful activity, walking in nature,
yeah,
walking outside, it really feeling, the smells and, or listening to things, so there's lots of activities you could do that are mindfulness that aren't just the sort of pay attention to your breath kind of thing. So,
yeah,
um, so our time is coming to an end. I think thank you so much. It went by so fast and I have so many more questions and really I'm so excited, to have you here with us today to join us. Thank you so much. It's just been so amazing to learn so much about the brain. I have some take home messages. Sleep, better get some better sleep. Be kind
be kind.
to oneself and to others, I think as well. And say hello to your cortisol when you wake up.
And then say goodbye to
Funny.
it rapidly thereafter. Yes.
Exactly.
It's been my
Exactly.
pleasure though. But you do owe me a real coffee when we can.
I do. I am. I promise I will be. But I just want to end by just telling people that we have another help talk coming up. Our next one is on June 25th, when our special guest will be Dr. Patricia Jennings from the University of Virginia. And Tish is an expert on both teacher well-being, teacher mindfulness. She's written many books on that, as well as trauma-informed practice. So I just want to thank you again, Lara. It's been such a pleasure to have you for this Help Coffee Talks, and I'm looking forward to our next session. Thank you very much.
Great. Thank you very much, Kim.
Oh, and I will say, be kind, be calm, be safe. From Bonnie Henry.